pressure. And a lot of times he will order it like for 30 minutes at 2, 3 different pressures and 3 different frequencies. Like he may say do it a pressure of 5 and a frequency of 5 for 10 minutes. And then 10 and 10 for 10 minutes, and 15 and 15 for 10 minutes. That way you're doing like a percussion, and then you're gradually increasing it, and you're doing it over a half-hour period. A lot of times we'll also do this with the nebulizer treatment. In other words, the patient, because a lot of times of this shaking helps kind of drives out the airway. So if you have their bronchodilator going at the same time, you're getting some moisture, they're getting their medication. If you're doing it to a cystic fibrosis patient, they're getting about 4 nebulizers. They get a bronchodilator, they get a mucolytic, they get antibiotic, they may get 3 or 4 different steroids. So you just keep putting one right after the other and letting them do that while they're taking this. And sometimes I'll even, if the medication runs out, I'll just throw some saline, just a isotonic saline, a little bullet,
Loosen it up.
just to give them a little bit more moisture while they're doing this.
Now, how much mucus would a person cough up after doing this for like 15, 20 minutes?
It depends on what they're condition. For example, a cystic fibrosis patient may cough up, half a cup, and it will be so thick.
And yellow?
Yeah. Green, yellow, depending on what kind of infection process they got going on. What was your question?
And that mucus is just bacteria, just a bunch of bacteria that keeps growing in their lungs?
Well, cystic fibrosis is a condition that affects both the digestive system and the respiratory system. It's a genetic disease. They're born with it, and they have it for the rest of their lives. When I first started in respiratory 20 years ago, cystic fibrosis patients, as a rule, never lived past the age of 16. 20 years later, they're living into their 40s. They have, their pancreas is affected, so they don't make the enzymes to help them digest their food. So their stools are really oily and slimy. They can't digest food. They have no good appetite. They have to take enzyme tablets that are about that big, and they take about 20 of them a day just to help digest their food. That's why a lot of them are so skinny and emaciated, because they have a digestive problem. So they can have just a digestion problem, or they can have the pulmonary problem, and that is their lungs produce this god-awful thick mucus that you have to see it to believe it. It blocks all of their alveoli, it blocks all of their bronchioles. They have so much trouble breathing. Most of them are on oxygen. They have to take these treatments and set the rest of their life. Like I said, they're taking 3 or 4 nebulizers at a time, 3 or 4 times a day, for the rest of their lives. And they have to have chest PT. They have to have chest PT.
You can't develop cystic fibrosis later, though.
No, you're just born with it. Now, some people are born with it, and for the first, maybe 5 years, the doctors think they have asthma or something because they have constant respiratory, and then they don't discover until later that it's really cystic fibrosis. They do what they call a sweat test. Because of the digestive problem, their bodies produce more sodium. So they put a thing on their arm, and they collect the salt to see if it's got an extra amount of sodium in it, and that usually is a
indication
diagnosis that they have cystic fibrosis.
When cystic fibrosis patients, they're doing that, would they just sit there on a chair like that? Or could you put them in Trendelenburg position?
Well, we do the Trendelenburg position when we're doing this. But when they're doing the vest, they can just sit there. Because the good thing about the vest is they have these at home. So they're doing the same thing at home that you're doing in the hospital with them.
I said, what if they did both at the same time? Because that wouldn't that
It might work better because you have the whole gravity thing going on, but they don't. If you're lucky, you get them to just do that much.
So we can look into that. We can make money.
Still looking to make money. Good.
What's about it?
Okay, so we did adult chest PT. Vibration. When you're doing chest PT on a person, you also want to do vibration.